Hello, I am Dr. Mohan Raut, a practicing gynecologist for last 27 years and partner of ICPRM, India's first immunotherapy center for treatment of patients with repeated miscarriages and IVF failure or implantation failure. Today, I am going to discuss the various investigations that will help us to find out what is the cause in a particular case of repeated miscarriages. Now, depending on the different causes, there are different investigations. When the problem is genetic, there are tests known as karyotype of the abortus or the pregnancy which is aborted is sent for a karyotype checkup, that is the chromosomal pattern of the pregnancy is checked. Also, karyotype or chromosomal pattern of the parents, both father and mother, are checked to find out if there is any genetic problem. For structural problems of the uterus, there are tests like sonography, especially 3D sonography, three-dimensional sonography. Then tests like hysterosalpingogram, which is an X-ray test. Then procedures like laparoscopy and hysteroscopy will help us to find out if there is any structural problem in the uterus. For detecting endocrine problems, test for diabetes like fasting and post-lunch blood sugar, HbA1c. For thyroid problems, T3, T4, TSH. For polycystic ovarian disease, the FSH and LH levels and sonography help us to clinch the diagnosis. For infection, there is a series of tests called as torch titer is done. In this, investigations are done for infections like toxoplasma, rubella, cytomegalovirus, herpes, etc. and it helps us in the diagnosis of infection. For the autoimmune problem, there are different tests which include anti-nuclear antibodies, ssDNA test, antiphospholipid antibodies, lupus anticoagulant, protein C, protein S. So these are the various tests which tells us about the autoimmune problem. Now, if all these tests are normal, then the factor that is responsible is alloimmune factor. And how will we find out that? So for alloimmune factor, we do certain more tests when all the tests so far are normal. And these tests are lymphocyte crossmatch, levels of natural killer cells in the peripheral blood and in the endometrium, a chemical called TNF alpha which is produced by lymphocytes in the blood. So these tests help us to come to the diagnosis of alloimmune problem. Once the diagnosis is achieved, the treatment can be given accordingly depending on which tests come positive. For alloimmune problem, the treatment is immunotherapy or lymphocyte immunization therapy, which is an active form of immunotherapy which helps to get over the alloimmune problem. For more about lymphocyte immunization therapy, I will talk in my next video. For more information, you can contact me on www.lybrate.com. Thank you.